Health and Family Welfare Principal Secretary Sampath Kumar said that the government is encouraging people to come forward for HIV testing, but there is significant hesitancy among males. Kumar also said that intensive awareness and community mobilization efforts are needed to combat HIV in the state. Kumar also stressed that HIV/AIDS is treatable with antiretroviral treatment centers available. He also informed that the department is working to stop new cases within 5 years, with around 9,000 people living with HIV/AIDS in the state.
In fact, our Honorable Health Minister was also there, and what the state government has been working is that to proactively, encourage, people to come for testing. That actually, in fact, with a lot of IEC and a lot of community mobilization. So a lot of people are coming. That's one reason actually why you see there is a increased number of cases that people are seeing. But it's a good thing because people are coming for testing. That's a very important thing. And because AIDS can be treated, we have a very good treatment procedure is there, so antiretroviral treatment, ART. So we have ART centers are there. So this is something that's very important, and one of the important messages that we would like to communicate is especially there is a lot of hesitancy from the male participants. So essentially we need more and more participation, and in fact we have asked all the medical officers to go to the nearest high schools and to conduct awareness programs so that the students will get to know about it, what is the HIV and how actually one can protect themselves and prevent from this particular disease. So I think this is a step that actually the state is taking essentially to on a mission mode, to how actually in the next 5 years we will stop any more cases, any new cases. So that's a kind of a timeline that what we have been taking, and we are drawing up a very strategic plan to implement this one. So it's going to be presented before the state cabinet soon.
Alarming number of children are being tested positive for AIDS. So what is the reason, and what is the government doing?
It's not alarming. I would not say it's alarming, but yes, there are about 400 plus children living with HIV so far detected. So that's again yes, because the reason is that again if it can be transmitted, HIV can be transmitted from mother to the child. This is again a very important thing. That's why we have a system, and every pregnant mother would go for HIV testing also. It's called and then that's where no one should miss that part. That's again once it is done, and then there actually we can ensure that there is the transmission would not happen. So some of these things are coming up. What you are seeing, the data is essentially the Meghalaya AIDS Control Society is proactively promoting this, to how to stop this. Total persons living with HIV currently are around 9,000, and every year actually we are witnessing about 900 new cases coming up.
So last question, sir.
Yeah.
What is the government doing to mitigate this social stigma?
So that's one is that we are working. We had a meeting with all the honorable legislators. Through legislators, we would like to bring a lot of awareness to remove the stigma. And two, we also actually are involving a lot of NGOs, civil society organizations. Now actually we are going to involve the village health councils, which are newly elected bodies of healthcare in Meghalaya. And besides that, as I said, the students, especially the young people, will become our ambassadors. So we would like to use that strategy. In fact, we did this exercise. Some of the medical officers who have done this exercise, they are finding it's very interesting. In fact, some of the young boys are coming after the session. They are coming for testing because they just wanted to doubly make sure that there is no HIV spread. So I think that's a very good positive sign. So that approach that I think we would like to take.